Kellyanne Conway was on Greta Van Susteren's show earlier tonight. She laid down some of her items that she believes will be in the Trump plan. Buy health insurance over state lines.
Right.
What does that do?
Well, have you ever heard of a company called Aetna?
Yes.
Or United Healthcare?
Yes.
They sell insurance in more than one state.
Kind of everywhere I've looked.
The difference is what they're suggesting is that if you live in New Jersey, you can buy insurance in South Dakota because South Dakota has the loosest regulations and therefore will charge a price that reflects the fact that it's not real insurance.
I mean, currently there
so you'll get fleeced by buying
there are
insurance.
dozens of states all over the country who would be willing to allow health insurance policies to be sold that the state of California would never allow because they'd say they're substandard.
It's completely
or the state
ridiculous.
Of New York.
And besides, the issue with healthcare, as Dr. Dean knows, is not the insurance companies, because they pay for healthcare. The issue with healthcare is the price of healthcare that we pay as patients and that insurance companies pay. The other thing I think they're going to do, and I think we need to educate everyone in this country to beware of three words: high-risk pools. That's what they're going to sell. What they're going to say is they're going to provide insurance for everybody by putting people who are sick and who have pre-existing conditions into high-risk pools. That's exactly what was done before Obamacare. There were waiting lists, there were caps on the coverage, $50,000 a year, $100,000 lifetime, depending on the state. Everybody had to pay premiums of 150 or 250% more than everybody else. So if you take all the sick people and put them into one pool and put the healthy people in another pool, the healthy people get lower premiums because they're in a pool with just healthy people, but the sick people suffer, and that's the opposite of the purpose of insurance, which is to spread the risk. That is the scam of high-risk pools, and it never worked.
Create health savings accounts.
Well, that's nice.
Those are fine. Those are fine for small items, but they don't work at all when you're trying to decide whether to have a $250,000 heart operation.
You know, they've talked about having health savings accounts, you know, of $4,000 or $5,000, or having a tax credit of $5,000 a person. Healthcare in this country now costs an average of $10,000 plus per capita. So that if you have a family of four, if you're going to buy insurance, you're going to do anything, someone somewhere has to come up with $40,000. Having a health savings account for $5,000 or a tax credit for $5,000 or $6,000 sounds nice. You could then have a press conference and say, we're providing insurance for everyone. But you're actually providing insurance for no one other than those in the upper middle class and above who can afford it.
We're going to have to leave it there for the night, and it remains guesswork about what this Trump plan, if there is one, is ever going to be. Howard Dean and Stephen Brill, thank you both for joining us tonight. Really.